Thank you very much. Just great to be here today. Today's conference started off by hearing from the Cabinet Secretary and Caroline talking about the future of our health and care services, and the Cabinet Secretary being very clear around the role of technological innovation and the role that digital will play in how we change our services. We also heard from you as well when you had the opportunity to talk about your kind of top priorities, where digital very clearly came out amongst the top list. And of course, throughout the course of today, we've had the opportunity to hear some fantastic examples of innovative local practice, many of which either utilize digital, have digital at the heart, or rely on data extensively to support the changes that are being trying to be made. But obviously, this is only the start. One of the things that we're very clear on at a national level is how can we leverage the power of technology to change the way we deliver services, which is very much the focus of this last session today, to think about how can we use digital technology and how can we change the way we think in order to make the most of technology. Before I introduce the rest of my panel today, who will be taking you through a number of different points, there's two key points I want to get across to the audience. One is very much the fact that we already live in the digital age. No matter which part of society we interact with, whether it's the public sector, whether it's the private sector, whether it's our banking or our entertainment, we interact with that through digital technology. Most sectors have been fundamentally changed through digital technology. And yet in our health and care service, whilst we rely on and have some phenomenal examples of technology that support the way we work, the way we interact with our patients, with our clients, with our customers, with our service users is still quite very much in the kind of analog era, if you like. We're barely scratching the surface in terms of public patient access or interactions through digital, or in using digital and data to drive system and behavioral change. And that then takes on to the second key point, which has actually come across in a couple of other workshops today as well, which is digital is not a thing, but rather a way of doing things. It's about thinking differently around how we assess our capabilities. It's about thinking differently around, if we're going to be redesigning a service, how do we open up how patients interact with that service? And ultimately, fundamentally, it's about re-examining our entire way of doing things. It's taking those two key points and thinking from a government perspective, okay, so how do we create the enabling culture which supports you at a local level to make the changes that you need? But before I go into the actual vision of what we want to achieve, and before we want to bring in the rest of the speakers, there is obviously one point that I'm not naive about, which is that we're not starting from a level playing field. We know that across the country, digital practices do not permeate the totality of our health and care landscape. There are certain capabilities that exist in one part of the country that do not exist in our part of the country. There are certain technologies that do not interact with other technologies. We heard it very clearly, for example, from the Borders Respiratory Pathway test of change that was highlighted in one of the workshops earlier, that one of the big challenges is the fact that we've got this great technology, really improving patient outcomes, but one of the big challenges around adoption is how you integrate that into your core patient record and track care system. So we're not starting this from an naive position. We do know that we want to make this a far bigger aspect of how we deliver care, but we also know that in order to do that, we need to focus on some of our core infrastructure. So what is our vision overall? I'm not going to read out this entire slide. You can look at it yourself, but one thing I really want to highlight from the overall vision is the emphasis on design. This is not simply about taking technology off the shelf and plonking it into a service. This is thinking from the end to end, what does the design of this service look like? What does the design of the system look like? And how do we involve the people, whether that's staff, whether it's patients, whether it's management, in the design of that service? History is littered with some fantastic examples of digital technology that failed to be successfully adopted and failed to be successfully scaled because the design component has not been fully thought through. And that is why at a national level, we're very, very keen, not just to leverage technologies, not just to adopt technology, but to make sure we're designing it in the right way for the right purpose, for the right outcome. And that is fundamental to what we're trying to achieve. Now, ultimately, though, government can only set out so much of this. We can only say the words, and we can only create the environment through which this change will actually be delivered. We rely on people in this room, we rely on those in the NHS to actually deliver that change. And that's why I'm delighted today to be joined by Professor Jan Garner, who's the Chief Executive of NHS Lanarkshire, who's also the overall Chief Executive Lead for Digital, which in itself gives an indication of the importance that the Chief Executive's placed to this agenda. Jan is going to take us through a short presentation which sets out from the Chief Executive's perspective, why is digital important, what difference will it make, and what is it we want to focus on. We're then going to hear from Morag Harty, who's going to talk about the National Connect Me programme, which is giving an example of the sort of impact that a nationally supported implementation of a single technology can have to multiple local clinical pathways. We'll then hear a local perspective from Dr. Jim Crabb, who will talk about what it looks like in a psychiatry service as a clinician on the ground benefiting from some of these technologies, the difference it makes to the clinical practice, but also some of the challenges around adoption. And then finally, we'll hear from Albert King, who is the Chief Data Officer within National Services Scotland, around no matter what it is we want to achieve, we need good data to enable that change to happen. So Albert will talk through some of the data systems that we put in place and how that data can then help us drive the change we want to do. That's all I want to say from a government perspective. As I say, we're very much here to support the overall ambition. We're very much here to create that enabling culture